AskReddit by Still Tangerine 2782. Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself, you couldn't make it up. She walked into the room, saw her own scans with the doctor and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. What's her name and her book? It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, for example labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Internet high five from an oncology patient, thanks for doing what you do. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU, especially if it's a field of medicine I have no idea about, like say, derm. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC dart. Real question is, do you understand the prescription the other doctor writes? Just wanted to say thank you for one of the more original AskReddit questions I've seen in quite a while. Really interesting subject. The pace and density of the conversations is different, I'm sure. I'm an emergency physician who has over time treated various physicians in my community, including internists, surgeons, radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The radonc, for example, thinks and speaks differently than the orthosurgeon, and I felt like my treatment of each of them was really quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research stuff while you're out of the room, as compared to populations that request a more paternalistic bent and just want you to tell them what to do so they can get on with their day. I'm careful to credit that the number of hours that went into my family physician's training are the same as mine, simply a different topic. She knows tons of stuff about management and screening for chronic disease that I don't. And I know how to intubate people, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids that are scared and kids that are head injured. My mom's a GP and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For stuff like getting ultrasounds etc, then yes, they do discuss stuff like it's a group project. How was it growing up for you? Did she get over every little ache and pain, or were you just told to walk it off because she's seen so much worse? Asking because I know experiences from both sides. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book When Breath Becomes Air. At first in his cancer treatment he was very involved in the decision making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision making and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. One of the best books I've ever read. Here it is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist I certainly wouldn't be chipping in. For more generic conditions I had previously offered my thoughts to my doctor about what it could be. Ultimately I still go to the doctor as they can prescribe drugs, order tests for me that would be questionable for me to do myself. Your answer seems to be the most genuine and reasonable answer yet, Ty. Doctor here. In general, we are not good about going to the doctor. For me it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I am going to defer to someone with more expertise than me in that area who can make an objective decision. When I go to the doctors it's also like a group project. I let everyone else do the work and reap the benefits. I was sat in a consultation between two doctors with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient's doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know. My dad's a doctor, and he said he'd stay up till 2 or 3 AM discussing med school topics with his roommate, sort of for fun, and also for the obvious benefit. I always go to someone who don't know me, and I wouldn't say that I'm a doctor as well. On the other hand, my so is a doctor too, and whenever we feel something we do discuss it like a group project, in which he always refused any treatment until his symptoms got to the very worst. First of all, love the username. For some reason your comment reminded me of something that happened with my ex-husband. He's critical care anesthesia. My ex, an accomplished drinker, went in for a routine checkup with a doc he didn't know. Doc asked all the standard questions, including how many drinks do you have a day. My ex made up some lowish number that he thought would be appropriate. The doctor said, "Oh, that's a lot. You should have lied." My ex said, "I did lie. Did I not shoot low enough?" Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything, so if I or they get like the flu they just write a prescription. If they need specialists, they usually tell them they are doctors and they get better treatment like skipping lines or whatever, or they know each other already, so it's chill. I'm sorry this kinda sounds spoiled, but it's my experience. Sounds awkward. HMN. Looks like you picked up an STD. I prescribe a divorce. Greatest doctor call of all time. First paramedic here, not doctor. Call for chest pain side of the road. Guy pulled over to call 911, not local, just passing through. While my basic is slapping lids on, I'm getting some history. Guy is obviously well educated, knows his stuff and just speaks the lingo. I run a 12 lead, it's bad. Not end of days, just hey let's get the cath lab wound up and drive really fast. It's also a little odd. So I decide to flip it, 15 lead, flip it again, do a right side. Whole time we are making tracks to the ER. Guy asks about nitro and I start explaining that certain types of heart attacks can be made much worse with nitro. He asks to see his strips. Humor him, hand them over while I'm calling in my report. He thanks me, say I'm right, it's anterior etc, and he's going to needs his bypass etc. Freaking cardiologist. Coolest, most laid back PT ever. Having a freaking heart attack, and starts explaining to me about the surgical process he's about to be under. My grandpa was a cardiologist and he's the worst at knowing when to go to the doctor. As he got older he would get cardiac arrhythmia but keep saying that everything is fine and he doesn't need to get checked. I'm guessing everything was not fine. I try to act like any other patient. Medical people can very much sabotage their own care by taking shortcuts or perhaps declining to approach their own problems the way other patients do. It's a mistake. I have seen harm done that way. I don't come in for trivial things like self-limiting infections or things that are harmless because I know that they are. But I do go see my regular doctor for problems that really bother me or for routine exams like anyone else. It can be weirdly stressful to be the doctor or the patient in this kind of interaction. I've learned to not let it bother me when I am the doctor seeing other doctors. It can be harmful to the doctor as the patient if you let that kind of interaction get to you. I try not to generate stress for other doctors who see me and know what I am. That could be detrimental to me. Had a relative who was an old-fashioned veterinarian and probably the worst patient because of it. This guy would argue with his doctors about his prescriptions and then order the meds through the vet pharmacy cause they were significantly cheaper. Which makes sense, I guess. Why pay $50 for a particular med when he can source the exact same thing for $5? But still, it looked kinda funny when he was in his 80s hobbling around with heart meds that had 4 dogs only in big print on the bottle. Edit, clarify vet equals veterinarian. My mom is a nurse and never tells the doctors what she does for a living. It's so they'll speak to her not as a nurse but as a patient. Even though she can understand what they're saying when they use their medical jargon, she doesn't want them to be overly comfortable using the jargon while treating her. I can understand the idea, but that sounds so tedious. I know as a note person, on the rare occasions I have to get tech support for something, I try to let them know that I'm in it just so I don't have to go through the press the Windows key. It looks kinda like a wave flag at the bottom of the screen. You know stuff. Feels like it would be the same for healthcare. I already feel like they oversimplify things for me, and I'm not even in the field. Edit, to clarify, I don't blame medical professionals for over-simplifying things. Working in tech, I also understand that the average human comprehension of any remotely scientific field is staggeringly low. Resident here. We don't have time to see a doctor for ourselves because hospitals are too busy squeezing more work out of us. As an ERDR, when I go to my PCP, all decisions are made in tandem and I do have more input on my treatment plan than a layperson. But I second what others have said. When I'm seeing another physician like a specialist, I am more capable at making informed decisions than a layperson, but will always defer to their experience and knowledge. 2 examples. 1. Had a PCP that said jokingly to a medical student in front of me, "How the hell could he even sue me? He's a doctor." Promptly found a new PCP. It's okay to not like a doctor. Even doctors dislike other doctors. 2. I'm a doctor with literally tens of thousands of hours of experience and knowledge saving people's lives, and even I know that I don't know 0.1% of what Foci knows. Wear your goddamn mask. It's not a debate doctors are having. Just morons. Doctor here. Like someone else said, if I'm seeing a specialist of a particular field, then I'm unlikely to have anywhere near as much knowledge as them, so I would consult with them just like any other patient. If it's something more general and I'm seeing a GP, for example, I will tell them I'm a doctor so that they don't go into lengthy layman's explanations, but generally will try to have a normal doctor-patient relationship. I might throw in an opinion on what I think, but ultimately I try to shut up and respect that they're a professional and not tell them how to do their job. It's hard to be objective. 2. When the patient is yourself or a family member, having someone give their unbiased opinion is often more useful than self-diagnosing, or at least might add some more knowledge or insight that you may not have yourself. Forensic pathologist here. I keep my mouth shut and let my doctor. I have a pulse, so I am not the expert here. Doctors that self-doctor are scary and arrogant. IMHO. Subspecialty surgeon reporting in. In general, most docs have a basic understanding of general medicine and can have a collaborative discussion with their primary doc. When it comes to more nuanced issues involving referrals and consults, an informed discussion can still be had. One of the most crucial aspects of being a good doctor and surgeon is knowing what you don't know. Just like for any of my own patients, I will have a discussion but ultimately trust the other subspecialists to practice good evidence-based medicine in their particular field of training. I try not to tell them that I'm a doctor. I'm a very anxious patient. I just know too much about the terrible diagnosis which can change your life in an instant and have anxiety around my mortality. It's easier if they don't treat me like a knowledgeable professional, but like the irrationally fearful person that I am. Neurologist here. I always assume a rare, worst case scenario when it comes to me or my loved ones. I always rely on doctors. Healthcare has become so specialized that it's not possible to know everything outside your speciality. It's always good to ask for help. Having said that, I am a terrible patient. I've had to have a few doctor's appointments since starting residency. I've been enjoying acting like I know nothing about medicine. That way I can get a good feel for the provider. Because in all reality, if a physician, PA, NP, whatever, knows they are about to treat another provider, they tend to act more on their A game. But just like for my own patients, I'd hope I'd be getting the most honest care out the box without having any type of status tied to it. It's not rare for a doctor to self-diagnose and just go to a clinic to get someone to confirm it so they can get prescriptions, but you're not supposed to be diagnosing yourself and should be acting like any other patient. Describe symptoms and let them decide what you have for themselves. Always heard doctors are the worst patients. No, the worst patients are the ones that know the medicine and how things really work because their father, mother, best friend, works in medicine as a nurse, when really they work administration for a doctor in a completely different form of medicine. Yes, people claim their family member is a nurse when they are in no way an actual RN. Or we'll have people trying to use their knowledge from a different field and apply it. Like someone who worked with a single elderly patient with COPD, and therefore knew it was okay that his previously healthy daughter was desaturating to the 80s whenever she took her oxygen off and got angry when we said she had to keep it on.